Hi, everybody. Welcome. So today I want to talk to you about adenomyosis and traditional Chinese medicine's approach on where it comes from, how we diagnose it in Chinese medicine, how we offer treatment, and how we get you pain relief. First, what I want to do is briefly explain what traditional Chinese medicine theory is. If you haven't heard about traditional Chinese medicine, in a nutshell, I can tell you it's an ancient system. It's thousands of years old, but what it does is it focuses on looking at the body as a whole. Okay, so if you come into my office or you go into a practitioner and you're like, I've been diagnosed with a Western doctor with adenomyosis, then we have 10 women coming in with adenomyosis and you all might have a different treatment, similar, but different because you're a different person, because it's impacting your entire body, your entire health biome. And we need to see where it's really impacting you and where the inflammation's coming from. So it's really a root treatment system. So I hope that makes sense. And we just basically want to look at any underlying imbalances that are contributing or causing more inflammation in the body. So in traditional Chinese medicine, often what we'll say with adenomyosis, again, it just depends on the person coming in, but often it's a result of blood stasis. And we say qi, but oxygen stasis or stagnation in the body. And we'll say there's different organs involved, okay? Because they have different functions in the body. So it doesn't mean that there's something necessarily wrong in Western medicine sense, but we would focus on looking at an imbalance between the kidney and liver systems, okay? I don't want to lose you there, but we use diagnostic tools and that's how we know, but this includes like taking your pulse, doing a deep diagnosis on tongue examination, and of course, a very in-depth patient history or like a medical history. So we go over everything. And often what we'll do is we'll prescribe a treatment plan. And first of all is to get you out of pain and come up with a plan so we can get you out of that like 9 out of 10, 10 out of 10 above and bring that down and then create a realistic treatment plan that consists of herbal medicine. And herbal medicine works wonders, works very well for adenomyosis, for chronic pain. And I've mentioned this before, but dong gui is used in Chinese medicine for hormones, but different forms of it are also used to invigorate or move the blood in the body. And then peony is another herb that's really beneficial, especially for women's health and working with easing pain and moving pain throughout the body, out of the body, I should say. And then there's Romania that focuses on more nourishment in the body. So there's different formulas. There isn't one magic formula. There's different formulas depending on where the imbalance is for you and what adenomyosis looks like for you. Then we'll also look at working in acupuncture points or acupressure. I work with a lot of clients all over the US, but in other countries as well. And so what I do is I focus on specific acupuncture points that I use in my clinic right now in Colorado. But as far as like long distance, you can work with different acupressure or like a heating patches that are specific to stimulate acupuncture point. So it's really nice because you can do it at home and you can get relief this way. And that can open you up for other treatments like specific exercise or yoga therapy or different stretches. So keep in mind, like our main goal is to get you comfortable as soon as possible and with the least invasive type of medicine, okay? And we'll look at also diet. I talked about this in the last video, but diet's crucial because you got to focus on non-inflammatory or anti-inflammatory foods because that's going to clear up all the inflammation in your entire body, because when you have adenomyosis, that can impact other systems like digestion or sleep, and all these functions and systems in the body can get a little haywire, or like they can get really intense. So we want to look at foods that are super supportive to, like, again, Chinese medicine sense, livers and kidney, and we want to make things easy on the body. We want to keep the blood flowing. So how we do that, it's going to be not eating raw foods, because when anything's cold and you put that in your body, it tightens or tenses and slows things down. What we want to do is nourish your body with things like bone broths, dark leafy greens, but like lightly sauteed or like in a stew or something like that. So no cold foods, definitely no processed or like greasy, excessively salty foods, anything like that. So I hope that gives you some ideas. And what I should do is create maybe just like a quick one-sheet document on recommended anti-inflammatory foods and put that in the comments below, so you can check that out. Just real quick, I'm Dr. Gina, and I work with women's healthcare, and I specialize in women in different stages of life. So fertility, once you're pregnant, pregnancy, postpartum support, and then perimenopause, menopause, and longevity medicine for all women. Okay, next up we've got, and again, this is like under the umbrella of Chinese medicine, is going to be more about like psycho-spiritual, if you want to say, but like Qigong, Tai Chi, and then different types of meditation absolutely have huge impacts on chronic pain in general, but definitely with adenomyosis, because it does impact stress levels. It'll create mindfulness, and these activities that you can do on your own, and whether you do them 5 minutes or 15 minutes, or you start building up or do them once a day or twice a day when you wake up before you go to sleep, getting into this routine, you're building momentum where you start to feel better. So I highly encourage you to look into any of those recommendations. And as far as looking at Western medicine, I encourage integration, absolutely, because it's important to get a diagnosis. And if you're in extreme pain, there is a point, of course, check with your doctor, but you probably will need pain medications if you are at the point where you're thinking about surgical treatment. And it's unfortunate if you're in that situation. My heart goes out to you, because it's a huge decision. It can be very impactful in many ways. So definitely consider somebody who's more open to integration and say, look, I'm in a lot of pain. I need temporary relief. I'm working on a more holistic approach or a natural medicine approach, and I hope that you can support me while I try to heal myself with the help of either Chinese medicine or holistic medicine, and then also have you monitor me and then perhaps give you a little bit more pain relief support. So it is really important. And there's more and more Western doctors that are understanding of holistic medicine and natural medicine. They just haven't been trained in it. Don't get mad at them because they can't, they don't know anything about this. It's like, that's not what they went to school for. I went to school for that. There's thousands of qualified holistic practitioners, but you just want to make sure. What are their qualifications? Ask them. And I hope that you can find relief. Again, feel free, drop a comment below and subscribe. And then I know that you want more information like this. So I hope that you feel better and you get relief, and I will see you in the next video.